Oh, Harry. Here you go, baby. Well, hello and welcome. So I talked to someone who's a little bit more familiar with rats, and she suggested that perhaps Albert's just having trouble communicating. So we're trying this again. I guess they're on me. Hi. They're on me, I guess. We're trying some neutral space intros again with just Harry, because she's a little bit calmer. So, there's their cages. Let me see if I can't turn this around. Oh my god. Okay, well, this kind of works. I don't know... Albert, come here. I don't know how effective this is gonna be, because, he is still, a bully and picking on... He, singles rats out. So, oh my god, this is such a disaster. Hold on. I gotta get them off. Okay. There we go. How's that? Anyway, but I thought I'd go ahead and give it a try, so I'm going to be doing some neutral space intros with Albert and Harry, and then I will move on to... Okay. And I'll move on. I'll add Jelly at some point. They're doing fine together at the moment. I'm not really worried about him being mean to her during neutral space, because he's always been pretty good during neutral space. But, yeah, this is not going well. Oh my god. There's on my shoulder. Chilling. I have no idea how any of this looks, because they didn't want to cooperate and allow me to film the correct way. Hi, baby. Hi. But we'll see how they do. Sir? Oh. We'll see how they do. Yeah. I decided to go with Harry, because I don't think if he is having trouble communicating, Kelpie and Thistle are not the best candidates for that, just because they have no trouble communicating, but their communication is violent and angry. It's okay, Harry. And Harry has never been a very dominant girl. She's definitely the least dominant of the trio, Jelly and... Oh, look at them. Jelly and Clark are definitely way more dominant, which is, I think, why he never really bothered her during their intros. Don't be mean to her, buddy. Don't be mean to her now. I have no idea how any of this looks. Anyway, I figured I'd just take you along on the journey of finding Albert some buddies, because, yeah? Because he does need some buddies. Don't you, buddy? Yeah. And hopefully I'll be able to figure this out. Alright, I'm going to stop filming because they are not cooperating. Okay, now that I don't have, I do have a rat, in case you're wondering why my hand's over here. Thistle's getting cuddly again in her old age, and I'm taking advantage of it while I can. I'm over here petting Thistle while she's napping, and she's actually grooming me. She doesn't groom normally. She grooms with her teeth, and, that's normal, but she grooms with just, the very tips of her teeth, very gently. It doesn't even feel like she's doing anything, but pressing her teeth into me. It's just funny. She and Ursula also groomed a little weird. Kelpie was completely normal, but Ursula would also groom, similar to how Thistle does it, but a little less gentle with Ursula. Not that she was mean or put too much pressure, just a little less gentle, a little more pressure. Anyway, now that I don't have Albert and Hera causing chaos, I'm going to explain everything in a much more calm manner. So I talked to someone who has more experience with male rats than I do, and they think that because he, his laboratory setting and the fact that he lost his companion, perhaps he's having trouble communicating, and that's what the problem is. I think another issue is that because he's from a lab setting, the small cage is just not working for him. So what I'm going to be doing is I'm going to be doing neutral space intros with the trio, because if that is the case, Thistle and Kelpie are just not going to work for neutral space intros, because they have no problem communicating. They're just not nice. But I am going to be doing that, and I'm probably going to skip the little green cage when I do intros again and go straight to that blue cage right there, which makes me a little nervous, but I think it might help a little bit, because I am wondering if part of the problem is that Albert is just used to small spaces and throwing his weight around small spaces. I also do wonder if part of the problem is that he has only known male rats, because he was intact, and I assume they didn't use him for breeding, since they did give him up. He was in a, psych lab, so, and they, rehomed him, basically, to the rescue. So, like, I do wonder if he's used to just male rats, and male rats care a lot more about, like, the hierarchy in a mischief than female rats do. And so he's being just a little more assertive than he needs to be, because he doesn't understand the girls are just like, they're fine. They're just like, we can be friends. And then he just tries to dominate them, and just like, why are you being mean to me? I don't think he understands that. So that's what we're going to be doing. The only other thing I wanted to kind of talk about, this vlog is mostly going to be that. I think most of my vlogs, until I get him in with someone, is just going to be about finding Albert companions. But if other things happen, obviously I'll show them here. She has fallen asleep with her teeth resting on me. I don't know if I can show you. I hope you guys saw that, because I'm dying inside. Anyway, my cat Dax is going to be going to the vet because she's still not over her cold. So now I think we need some medical intervention. So I'm going to be doing that. And then the only other thing I kind of wanted to talk about was Kelpie. Nothing serious. I just I have this suspicion that she has something going on. She keeps stretching her lower half of her body in a way that indicates that she's uncomfortable, like in her abdomen, or maybe she has a tummy ache. And if she only did it once or twice, I wouldn't necessarily think of anything of it. She probably just ate something that gave her a tummy ache. But she's doing it at least twice a day in front of me. And that is making me suspicious that maybe there's something going on. And she feels very light, but her weight hasn't changed, which I was attributing to just like normal muscle loss from an old rack. She's 2 years and 1 month old, almost 2 years and 2 months old. But I'm starting to worry that there's something else happening. Like, I don't know. Her abdomen looks strange to me in a way that I can't really describe. It looks bloated, kind of, based on like how thin she is along her spine and her hips. And like there's a line where you can see where her abdomen kind of like puffs out a little bit, but it's very, very hard to show because it's just like, she just looks like a normal rat unless you know what she looks like normally. So like, I'm a little concerned that something's going on in there. I'm keeping an eye on it for right now, but once I get Dax squared away, if she's still doing the stretch, I might consider taking her in for an x-ray just to make sure there's nothing going on in her abdomen. But yeah, so that's like kind of everything that's going on right now. And yeah, we'll keep trucking. I probably won't show every little neutral space intro with Albert, but I'll try and show a few. So here's another little intro I did. I have all three of the girls out now, and as you can see, nothing too important to talk about. They are interacting. He's sniffing them a little bit. He, for the most part, doesn't show much interest in them when they're in neutral space, but he'll do a little bit. Like right here, he's sniffing Clark's butt, which is fine. That's normal. They're just getting to know each other. I did move him just because she was kind of close to the edge of the bed, and I didn't want him to like push her off the bed or anything. But like that was perfectly fine interaction. But yeah, the thing with this is definitely that Jelly, at any rate, is more interested in exploring than in him. But, you know, it's still all good, and I was pretty happy with how this little neutral space intro went for the most part. Your babies. Oh, they're sweeter. Do you want outfits? You want to go do stuff? She's a little old lady, so she needs help getting around sometimes. Like, when she's off this, she's good, but she needs help getting off this. Do you want out? Oh, hold on. Snail wants my shirt. Thank you, baby. Alright, come on, shoot. Do you want help? Okay, hold on. Let me drop off Snail. They can only sense when I'm filming. Okay, ready, Suits? Pop. And then she's gonna go into my shirt. Yep. And she'll hang out there for a second. Yeah. And then she crawls out. Let's see if she wants over here, if she wants to be on the desk. Oh, you just want to hang out for a second? We can do that. Okay. She usually goes onto the dig box or she wants on the desk, and then I'll move her as she needs. Hi, baby. Hi. Hi, baby. Oh, thank you for the kisses. Thank you, thank you, thank you. Oh, my old lady. Oh, shoot her. Hi, baby. You gonna... Are we just hanging out? She almost never hangs out. She's an old lady, but she's not an affectionate old lady. No. Yeah? Are you done? All right, let me put you in front of the water because I feel like that's what you wanted. Okay. Ooh. Let's see if that's what she wants. Oh. No, you just want to run around? Okay. She's just going to run around a little bit. I'll keep an eye on her. Anyway, I wanted to discuss Kelpie. So, I found her today, like, just in a bad way, like, puffy, not cool to the touch, but not warm the way, like, a rat should be. Hi. Pop. Pop. That's new. And just, like, not good, not feeling good at all. So it could be a reaction to switching the Aspen. Everyone else is doing fine. A lot of them, like, their porphyrin's cleared up for a lot of them. Like, the baby trio, yeah. Snail really wants to be involved. The baby trio, they were having some porphyrin issues. It's cleared up. Lois, a lot of her porphyrin has cleared up. So, like, I don't think it's the Aspen that did it, but switching beddings can just cause respiratory issues if it is a respiratory issue. So I am going to be putting her on some antibiotics. I don't know if it's a respiratory issue because, like, I listened to her chest and it sounded clear. She's not making any noise. She has no porphyrin. So if it's a respiratory issue, it's an asymptomatic one, other than the fact that she's kind of puffy and feeling really not good. But, you know, when in doubt with rats, try respiratory, like, antibiotics, because, like, a lot of times it is that issue. They have, like, really sensitive little lungs. I am concerned that it's something else because of, like, her stretching her tummy weird and, like, feeling strange. Like, I don't know. She's felt strange. There you go, baby. To me. And she hasn't shown any other symptoms other than, like, stretching in an odd way, but I'm still concerned that, you know, it's something like that. I gave her some pain medication because I want to see how much that improves her state, because if it's like a pain issue, because these are the same symptoms for pain and respiratory oftentimes, like, have the same symptoms if there's no, like, audible respiratory issues. So, like, if it's a pain thing, then I am definitely going to have to take her into the vet to get an x-ray. Oh, lady. Oh, lady, do you need help? Get ready. To be clear, Suitor can get around on her own. I just help her because she's my old lady and I can. So, but, like, in the cage, she moves around just fine. She does have HLD. It is affecting her mobility quite a bit, but she is capable of navigating the cage very well. Me helping her here at Free Roam is just it's just because I can and I want to, and she accepts help. It's as simple as that. But she is fine doing it on her own. Anyway, yeah, baby. Kelpie. If the pain medication reverts her back to her normal state completely, then I'll be getting her. I'll in all likelihood be trying to get her an x-ray, because then that's an indication that there might be something going on inside. She's 2 years and 2 months old. So, like, she is old. She's a senior girly. She's an older gal. She's not as, it feels weird sometimes because I feel like sometimes people don't necessarily view them as, like, elderly at this age, 2 years and 2 months, but it's like, she is elderly. She doesn't look it and she doesn't necessarily act it, but she is elderly. And it's like, I have Suitor, who's 3 years and 1 month old, and, like, yeah, she is extremely geriatric. Suitor is beyond geriatric. So, like, it's kind of complicated to talk about because, like, technically Glitchin, Mystic, and Agatha are all seniors now too, because Glitch and Mystic are 2. Mystic's 2 years, 2 months old. Glitch has just turned 2, and Agatha is a year and 9 months old now. Yeah, a year and 8 months old. And she is old. She's a senior girly, so, like, it's a little complicated. And then, like, the quad's gonna be senior soon because they're a year and 5 months old. So, like, I'm about to have a lot of senior rats, y'all. And I get myself into this situation a lot where I just have a lot of senior rats. But yeah, I am hoping that the antibiotics help Kelpie because she was just in a really bad state. So we will see. There's a blooper butt. Snail is over there. I don't know where Irving went. I feel like Irving is in the desk somewhere. But anyway, yeah, I just want to give you guys that update. I'm still working on getting Albert, and I'm still doing like the neutral space intros with Albert and the trio. I'm going to continue to do so. If there is something severely wrong with Kelpie and we're looking at possibly losing her, I haven't decided what to do about Thistle, because it's like I have Albert and I could try her with Albert. She wasn't the one, like she was like attacking him a little bit. She was attacking him a little bit, but she wasn't necessarily the big problem. It was definitely Kelpie who was the big problem. But it's like, I don't know. I guess I haven't decided the balance between doing what's best for Thistle and what's best for Albert. Because having 2 lone rats, I would not be pleased. I'd be very, very unhappy. And like in theory, getting them together seems like the better option. But if like Thistle is very resistant to the idea, don't I have an obligation to like figure out Albert first and then figure out Thistle second? So I haven't decided the best option there. So hopefully Kelpie just has like a little respiratory issue, and I can take care of it with some antibiotics. Again, I don't think the aspen's necessarily a problem. It could just be switching the beddings caused this if it's a respiratory issue. But yeah, I am concerned. So we'll see. We'll see. I will update again soon. Kelpie update. So, as you can see, she's eating a treat. So, she's actually just fine. She's doing really well. She bounced back completely. So here's what I think happened. I think I caught her at the very tail end of a really bad choking issue. I think she had already dislodged whatever she had choked on, but she was still uncomfortable. She was still uncomfortable because oftentimes when rats have a really bad choking incident, hi, you want to show everyone you're doing? Oh, look at you, cutie patootie. Oftentimes when rats have a really bad choking incident, their throats get inflamed from trying to dislodge the thing that's in there. Now, when I found her, she was like cool, but she wasn't cold. Like her body temperature was a little lower than what it should have been. She was lethargic. She was clearly just uncomfortable. And I think when I gave her the pain meds, it helped. Hey, baby. It helped take down the inflammation in her throat, and she bounced back. Haven't had to give her more pain meds. Now she's doing the weird stretchy thing again, though. You gotta stop doing that. You're worrying me. But she, over the course of the next, I think it was really bad because she still didn't bounce back quickly. She is peeing, in case you're wondering. It took her, I'm going to say it wasn't until like 4 o'clock that afternoon that she was like acting normal again. So it had to have been a really bad one. And I think it was that just based on other instances I've had where rats have choked and like how they recovered. So as you can see, she's doing great. But yeah, I do think that is what... Oh, you're so pretty. Look at you pretty. I do think that's what happened, but now she's all good. I will be monitoring her just because a lot of times when they choke, they do aspirate the food that they choked on, which can give them pneumonia. So we're going to keep an eye on her, on my cutie patootie, just to make sure. She's so beautiful. Look at her. Isn't she gorgeous? Just to make sure that she doesn't have any issues. Oh my god, you're so beautiful. But yeah, so otherwise she's all good. And she's completely back to normal. And it's only been 24 hours. So yeah, that's good news. With her age, I was really concerned it was something serious. Especially since just like, she wasn't showing any signs. Any of the normal symptoms of choking. Which like, is mostly just like, it's not gagging. Rats don't have a gag reflex. But it looks like gagging, so I'll just say the appearance of gagging. But yeah, she wasn't doing that at all, so that's why I think it was like the very tail end. Thank you, Thistle. But yeah, we're good. She's good. We can relax. Barely any time has passed since my Kelpie update. She's still fine. I have Suitor in the quad out again, but I wanted to. Did you just steal from Suitor? No, that's fine. All right. I just wanted to give a different update on Thistle. So I had her out on my chest, and I could smell infection. Like, if you've ever dealt with an abscess, it has a very specific smell. And I was just like, what the hell? And she was pointing at me, so at first I thought it was coming from her mouth. But then I realized that the smell was stronger on one side of her head than the other. So I figured out it was from her ear. And I looked in there and I could see something, so I cleaned it out, and some like, sorry if this is disgusting for you, like green pus came out. So I'm guessing she has an ear infection and she needs to go on antibiotics. These two really timed it perfectly, huh? Both of them having an issue at the same time. Maybe B. So yeah, there's a chance that she had like an abscess in her ear or something, but like pus in the ear, antibiotics. You don't want to risk an ear infection. So that's what we'll be doing with her, and hopefully it'll clear up quickly. And it's just an ear infection. It's not anything more sinister looking underneath that, or masquerading as an ear infection, I mean, because sometimes that happens. Sometimes that happens. But yeah, I'll be doing that. Hey, BB. Hey, Thistle. She's still got gunk in her ear, just so you guys know. I don't know. Can I see in your ear? I cleaned it out just now so that you probably actually can't see anything, but she's still got something going on with her ear. But we're here. Oh, did Kelpie get you back? We're going to talk about Kelpie. I don't want to disturb her too much, but here she is. Hi, baby. And she's not feeling good again. It's not as bad as last time, but she was fluffed up. She was uncomfortable. Her temperature was affected. Here, Cecil. There you go, baby. Oh, you got it. You got it, girl. Oh my god. Old lady. She's still uncomfortable, so I have a vet appointment booked for tomorrow. Not at the vet I like. I have her booked at the vet where we get Ginamo's teeth trimmed. And I like them okay. They're just a little, I don't know. They're a little impractical about a lot of things when it comes to rats. So, like, I don't really like them, but they'll do for this because I want to get an x-ray done. Because I do feel like something's going on with her. I worry. She doesn't really have any symptoms of, like, respiratory issues or heart issues. She just seems to be in pain. She just seems to be uncomfortable. So I do really worry that there's something going on. So I've got her booked in for an appointment tomorrow. And hopefully everything will be fine. I'll probably leave Thistle at home. Because if they have to take her back, I don't trust that they'll be able to tell them apart. Because, like, I don't know, to me, they're very distinct, but, like, because they're actually two different shades of blue. But, like, I just don't think that I can trust them to tell the two of them apart. So, like, I think I'm going to leave Thistle at home and just take Kelpie, which makes me a little bit nervous, but I'm also just nervous about the appointment in general, just because, like, this is the second time this has happened. And I do worry that if they find, like, a really large mass in our abdomen or something, like, yeah, I don't know. But, hopefully that's not what happens. I don't know, just something's up with her, and I don't know what it is, and I am concerned. But yeah, I'll update you tomorrow with what happens with Kelpie. Alright, so I'm back from the vet with Kelpie. So we did not end up doing the x-ray because we didn't need to. They could feel her abdomen just through palpation, and she does have 2 masses in her abdomen. So they're most likely attached to, one's most likely attached to her intestines, possibly both of them. And it's entirely possible that one's attached to her spleen because her circulation hasn't been amazing. That is where we're at with that. So, I did bring her home. I'm opting to do palliative care. Considering that she is in pain, it wouldn't have been, like, the worst decision in the world to let her go today. But when she's on pain meds, pain's not consistent, A. And B, when she's on pain meds, she is acting completely normally. So I did decide to bring her home today. For that reason, I am hoping to get a few more weeks with her. She's going to be on prednisone and gabapentin. She's on gabapentin because you can't mix NSAIDs with steroids, I believe because it causes bleeding. I haven't looked it up in a while, but I'm pretty sure that's it. So she's on gabapentin and she's on prednisone. The prednisone will be once a day. The gabapentin is for up to 3 times a day, up to every 8 hours. And the dose has also got a pretty good range to it. So I'll be starting her on that tonight, because right now she's doing okay. She's not, like, bothered at all at the moment. So, like, she is on palliative care. She is in all likelihood not going to be with me for very much longer because 2 masses in the abdomen is just, it's not good. And I haven't seen very much success with removing masses in the abdomen because they're probably most likely attached to the organs already, and like having to, it's just like a whole mess. And rats are really tiny, and like she's over 2. So that's why I've opted to do palliative care. And that, and because I also just really want to be able to put her to sleep at my normal vet, because I had to go to my backup vet today, and my normal vet lets me hold them. And I just really, really, really want to be able to do that. It means a lot to me. So I'm going to be doing palliative care hopefully for several weeks. I'm hoping I still get a little bit of time with her, but she is, you know, being a rat owner is such a different beast than being like a cat or a dog owner, because with like, cats and dogs, it's just like you bring them to the vet, she's like, yeah, they're like pooping blood and they like really lethargic and like just not themselves, and the vet's just like, okay, well, they're allergic to this food, switch them to this food and they'll be fine. And that's exactly the case. And then with rats, it's just like, my rat stretched funny, so I think she has a tumor in her abdomen. And they're like, well, not only does she have a tumor in her abdomen, she has 2. It's just such a different beast. And like I've mentioned in a couple of videos past, I felt like there was something wrong with Kelpie because she hasn't been acting like herself. She's been like a little aggressive, which is not like her with like other rats, not with Thistle or me or even Cappy, but she's just like, when I tried intros with Albert or the babies, she was just aggressive, which I wasn't anticipating. And I do feel like this is probably why. Aggression's not always hormonal. It's not always like a behavioral problem. It is oftentimes a medical issue. So this is absolutely, I feel like, why she's been acting so off in intros, because even with the last intro with Albert, you saw that she was trying to like be friends with him, and then she just turned on him at like the drop of a hat. So I do feel for sure that is what happened there. Even at the vet, she started getting like poofy and bothered, and I was just like, okay, I don't think she'll bite, but she might bite. And the vet was just like, we just assume everyone's gonna bite, which is a good policy to have, but I still wanted to warn them because it's just, I don't know, just nice to warn them. So even though it was my backup vet, I got my favorite vet from my backup vet, which I almost never get, and I like her a lot. And like all the vet techs I've never had an issue with the vet techs. They're always so super sweet. So like never be mean to a vet tech. I don't understand why people do that. But yeah, Kelpie she's on palliative care, and this is also a good example of like, you guys know I'm a big advocate for spaying for the health benefits. I talk about it all the time, but I always try to emphasize that like, that does not guarantee that your rat's going to live a long time or not get any tumors. Because like Kelpie is spayed. She got spayed at 7 months old, and she's got tumors, and she's only 2 years and 2 months old, and she's not gonna make it to 2.5 like a lot of my spayed girls have. So like I always try to like emphasize, it's just like, I am an advocate for spaying, but never assume that spaying them means they're gonna make it to 3 or never have any issues. So like I always try to emphasize that, just because it's like, it is a risk and people get like nervous about it, and it's like, there's no guarantees with rats. There isn't. So like, yeah, I'm sad. I'm very sad. I also wanted to say, it's like, I get the comment a lot of just like people who don't understand how I have so many rats, and I've consistently had so many rats, and I consistently lose so many rats because I consistently have so many rats. And it's just like, I feel like people think that it's just being strong with grief, which isn't a thing. You grieve how you grieve. It just means that you aren't like affected by their death, or you don't cry. And I will have you know, when that vet said there's 2 masses in her abdomen, I absolutely started crying in the middle of that vet office. I was so upset immediately, because it's like, I've been talking about it for weeks, how I just felt like she had mass in her abdomen, even though I don't know how to palpate, so I didn't know how to check. But and I was right. And it sucks. It sucks so bad. My cat's right here and purring, if you can hear her. Look at her. She looks mean, but she's really very sweet. But yeah, I guess that's probably gonna be it for this vlog. There's been so much going on. I'm probably gonna have to immediately start another vlog. Yeah, Albert has a URI, probably from the Aspen. So he's, whoops. So he's also on meds. I'm not too worried about it. I'm still gonna try him with the trio again in like a week and a half from when I'm filming. Hopefully by then he'll stop making noise. It is definitely upper because he's acting completely fine. He's not got any other problems. So yeah, he's on meds. Thistle's on meds for her outer ear infection. Kelpie's on meds for her internal tumors. Jinx is on meds for her ear infection because it came back. It's fun being a pet owner. But yeah, I don't really know. I'm trying to think of like a positive way to end this, and it's just like, yes, I'm deeply, deeply upset about Kelpie. But I do know that I gave her a good life. And she has hopefully several weeks left. Again, her pain's not consistent, and she's on all the right medication, so hopefully she'll be around for a little while longer. As for Thistle, when Kelpie goes, I'm not sure exactly what I'll do yet, because I'm going to prioritize getting Albert in with companions, because I think that'll be easier than getting Thistle in with companions. So, like, I need one of them to be fine, so I'm going to focus on it being Albert. But yeah, I guess I'll end it here, and I'll just start the next one. But yeah, I hope you enjoyed this video. If you did, you know what to do. All the fun stuff down below. And I'll see you in the next one. Goodbye!